Hi there, I'm Dave Bargell. I'm one of the medical students.
Hi.
Can I just confirm your name and date of birth?
Yes, it's Harry Hook, 7th of April 93.
Okay, Harry. Do you mind if today we examine your lower limbs? It's going to involve me moving your legs a bit and asking you to walk a bit. Would that be okay?
That's perfectly fine.
Okay, for this examination I'm going to need you just to roll your shorts up for me, and if you can just lie back on the bed when you're ready.
Okay.
Thank you. Are you in any pain at all?
No.
Okay, I'm just going to start by having a look from the end of the bed.
Okay.
So I'm going to start off by assessing your walking. Are you able to walk unaided?
Yes, I am.
Okay, can you just swing your legs to the side of the bed for me? Okay, and just cross your arms over your chest like this, and just stand up without using your hands. Fantastic, thank you. So if you can start by walking towards the couch. And turn round. And now if you walk with one foot in front of the other, please. Okay, and now walk on your tiptoes. Okay, and now walk on your heels. Can I ask you to put your feet together, your hands by your side. I'm going to ask you to close your eyes as well.
Okay.
I'm here to catch you if you feel unsteady. Okay, and just open your eyes up for me. That's fine, thank you. I'm just going to check the tone in your legs now. Can you just let your legs go floppy for me? So I'm just going to move your ankle now. If you can just let your foot go floppy. I'm just going to lift your leg. That's it. And the same on the other side. Thank you. Okay, Harry, I'm just going to test the strength in your legs now. So if you can start by just lifting this leg up for me. Okay, and stop me from pushing it down. Good. And just lift this other leg for me. And stop me from pushing it down. Good. Okay, and push this one against the bed for me. Okay, and push this one against the bed for me. Good. So if you push your legs together, that's it, and push them apart. I'm just going to bend one of your legs, okay, and if you can bring your ankle towards your bottom for me, okay, and stop me from straightening your leg. Good. Okay, and the same on the other side. Bring your ankle towards your bottom, stop it from straining your leg. Good. Okay, and once again we're going to bend it. Now if you kick out against me, try and straighten your leg. Good. And kick out against me and straighten your leg. Excellent. Okay. So now if you can bring your toes in towards you,
Okay.
and stop me from pushing them down. Good. And same on the other side, bring them towards you, and stop me from pushing them down. Good. Now push down against my hand. Okay, and push down against my hand. Good. Now bring your big toe in towards you and stop me from pushing it down. Good. And stop me from pushing it down. Now if you can just push your foot in against my hand. Okay, and push your foot in against my hand. And push your foot out against my hand. And out against my hand. I'm going to test your reflexes now, which is going to involve me tapping just with this small tendon hammer on parts of your legs. Okay, so I want you to let your legs go floppy for me. Okay, let me take the weight. Okay, same on the other side. Just let it go floppy. Let me take the weight. Okay. Okay. Now, if you can bend this leg and just let it flop out to the side for me, and just relax your ankle. Just let it go floppy for me. That's it. Good. Same on the other side for me. Flop it out to the side. Okay. Okay, that's fine. Now I'm just going to run the blunt end of this neurotip just against the sole of your feet. It might be a little bit ticklish. Okay.
Okay.
thank you very much. I'm going to test the sensation in your legs now.
Okay.
So I'm going to start off by using this piece of, this wisp of cotton wool. Okay, so it's going to feel like this. Can you feel that?
Yes.
Good. So I want you to say yes when you can feel it in your legs, and I want you to close your eyes for this, okay?
Okay. Yes. 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 Yes.
Did that feel the same on both sides?
Yes, it did.
Okay. Now I'm going to test sensation with a pin. It's going to feel sharp, but it won't pierce the skin, okay?
Alright.
So it's going to feel like this. Can you feel that?
Yes.
Okay, now I want you to close your eyes, and I want you to say yes when you can feel it on your legs.
Okay. Yes. 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 Yes.
So I'm going to test the vibration sensation in your legs now. I'm going to use this tuning fork.
Okay.
So it's going to feel like this. Can you feel that vibrating?
Yes, I can.
Okay, that's fine. So I'm going to test that vibration sensation in your legs. I want you to say yes when you can feel it vibrating. Now if you just close your eyes for me.
Yes.
And tell me when it stops.
Stopped.
Good. Okay. And the same again. Tell me when you can feel it vibrating.
Yes.
And tell me when you feel the vibration stop.
Stopped.
Good. That's fine. I'm going to test the joint sensation now. It's going to involve me moving your big toe up and down. Okay, so this will be up.
Yep.
And that'll be down. And I want you to close your eyes and tell me whether I'm moving it up or down.
Alright.
Okay?
Up. Down. Up.
Good. So the same on this side. So this is up.
Okay.
And that's down. I want you to tell me whether I'm moving it up or down.
Sure. Up. Up. Down.
Good. Thank you. I'm going to test some of your coordination now. I want you to put this ankle on the other knee, run it down your leg, lift it off, and go back to your knee and run it down your leg, and keep going in a circle. That's it, as quick as you can. That's fine. Now, with the other ankle, I want you to touch your knee, run it down your leg, lift it off, and go back and keep doing a circuit. That's fantastic, thank you. So now I'm just going to ask you to just tap your feet against my hands as quick as you can. That's great, thank you. That completes the examination. Thank you very much. You can put your shoes and socks back on.
Thank you.
Thank you. I performed a lower limb neurological examination on Harry, a 21-year-old gentleman. On inspection, there was no abnormal posturing or deformities noted, and no muscle wasting or fasciculations. Tone was normal throughout, and power was 5 out of 5 in all muscle groups bilaterally. Reflexes were normal and present at the knees, ankles, and the plantars were down going bilaterally. The coordination was intact, and sensation was normal in all modalities tested. The gait was normal on assessment. So in summary, this is a normal lower limbs neurological examination. To complete my examination, I would examine the cranial nerves and the upper limbs neurologically.